Joining us now, she's the Deputy State Director of the famous organization of all time in Virginia, Americans for Prosperity, Lauren Toomey. She's out there fighting every day. I love when I go to the General Assembly. You can always see Lauren there. She's there every day along with her staff and her director, J.C. Hernandez, and their lobbying members of the state Senate and the House of Delegates in order to get their agenda through, educating them, giving them information. They do a great job in Virginia and have for a very long time. Plus, they're the biggest grassroots army in Virginia, and they are nonpartisan, which is even better. Lauren, great to have you with us again.
Good morning, John. Happy 2019.
I know. Happy New Year, Lauren. Now, lots going on in the General Assembly in 2019. Yes. Americans for Prosperity, Lauren, as Deputy State Director, what's your top agenda items in 2019?
Absolutely. This session, Americans for Prosperity Virginia, is really focused on transformative policies and legislation. We're really looking to break barriers for all Virginians across the Commonwealth. Our top priorities include expanding telemedicine across Virginia. So technology now, as we know, is amazing. It's brought us things that have made our lives more convenient, like Uber, Amazon Prime, which, you know, my fiance will tell you we get way too many blue tape boxes to the front door, but saves me a lot of time. And, you know, telemedicine really works in innovation into healthcare, which ultimately expands access and lowers costs for more people across Virginia. So we're super excited about that. Our Libre Initiative brand, the Hispanic Freedom brand, is also going to be engaging on that because Hispanics are actually the third constituency that will benefit the most from telemedicine. So we're super excited about that. Other things we'll be looking at, criminal justice reform. The president has, you know, done that on a larger scale with the First Step Act that our network was very involved in lobbying and extremely supportive of. At the state level, we're going to be looking to eliminate driver's license suspensions for unpaid court fees. So Senator Stanley has a bill in the Senate right now that would end the practice of suspending driver's licenses of Virginians who have unpaid court fines and fees. Now, your court fees could be for something that's not related to driving whatsoever. So not only is this practice completely silly, but it actually disproportionately harms minorities and low-income communities, and especially those in rural communities. You know, if you don't have a driver's license or a vehicle in Northern Virginia or, you know, more urban areas, you can maybe walk to work or take public transportation. But out in the rural areas, you know, losing your driver's license really means losing your opportunity to work, which is one of the largest things that we've found of keeping people out of the court systems is that they are working and contributing. We'll also be working on reforming COPN. It's something that our network has been involved in, our state chapter has been involved in year after year in the General Assembly. COPN is Certificate of Public Need, which is a government permission slip and kind of a government certificate that allows hospitals to offer specialty services. So again, we want to reform that program so that way we can expand care and access to those all across Virginia. So we've got those policy priorities, you know, really upon their passage will really be transformative in the lives of Virginians. So that's what we're really focusing on this year is breaking barriers and the policies that will do exactly that.
You know, I want to start by talking about something I'm very, very passionate about, which is Senator Stanley's Justice Reform Bill. You know, Jill, this practice of suspending driver's license because people can't pay court fees or costs is one of the most insane injustices out there. I mean, it's just, you know, you look at this and you say, again, I mean, who would even concoct this? Because, look, if you can't pay the court fines, it's not because you don't want to, it's because you don't have any money, right?
Right.
And so, and then you take your driver's license away, so then you lose your job, or you can't pay your car, or you can't pay your rent, or your family gets thrown out on the street, or what you do is you drive anyway, right? Because you have to support your family. So then what happens?
That's right.
Then what happens, Lauren? Then you get stopped because your taillight's out, or you
That's right.
were weaving in a lane, or people get stopped. Doesn't mean they're bad people. You get stopped.
Mm-hmm.
You get stopped. You hand it over. Up. Now you're arrested. Now you're handcuffed. Now you go back to jail. Now you lose your job again and your car. It is insane. And here, it's propagated by those people in the prison for profit business that get paid to fill up beds. And so they lobby the legislators to keep this stuff so people can get arrested and go to jail, screw themselves forever, and then so they can fill up a bed and make money. Is that about the sickest system you've ever heard of, Lauren?
Yeah, it really, besides the fact that it when I first heard about this practice in Virginia, I said, oh, you must be getting your license suspended because your court fees involved, maybe you're going 84, reckless driving, and it really has nothing to do with it. It's completely counterproductive, right, to actually solve the problem of someone not being able to pay their court fees, someone being in court. And like I said, it affects low-income Virginians. To your point, John, people aren't necessarily not paying their court fees to be reckless. They're not paying them because they don't have the means to do so. So then doubling down by suspending their license, cutting out their way to make a living. Mm-hmm. Driving is the only means many Virginians have to access their jobs. So suspending these licenses over unpaid fees forces people in these situations to choose between losing their jobs or literally risking jail time for driving anyway. Nuts. So I'm really excited to see Senator Stanley's bill. It has a broad-based coalition of support on both the right and left. I think we can all agree that this is a very common sense policy. And that's the same with all of our priority initiatives this year. They're really fueled with bipartisan support and broad-based coalition. So we're excited about that. Again, transformative policy to break barriers for all Virginians, and this will certainly be a large one.
Well, you're going to run into opposition because of the lobbyists that I say. They're going to be running around the General Assembly. These are going to be the bail bondsmen. They've got lobbyists, the for-profit jailers trying to fill up beds. They've got lobbyists, and it's a completely sick system. And so I applaud you for taking this head on. Let's get to expanding telemedicine.
Yes.
Is there legislation for this? Lauren Toomey, by the way, we're with Lauren Toomey. She is the Deputy State Director of the Virginia chapter of Americans for Prosperity. Is there legislation for this, Lauren, and how does it work?
Yes, sir. So there is education in both chambers now. So in the Senate with Senator Chafin and also in the House with Delegate Kilgore. So Virginia right now, you can practice telemedicine, you can receive telemedicine, but it's a little bit difficult. And there are a lot of barriers that prevent that market from really being opened up in Virginia. So how the bill works right now is focusing on reciprocity, letting reciprocity of remote care and reimbursement. So reforming the way reimbursements are done for telemedicine. Also, remote care allowing out-of-state providers to administer telemedicine in Virginia. That's a huge component of it. So the knock against that is that, or the way the policy is now, basically says that you can receive telemedicine as long as the provider is in Virginia or has seen you before, or a number of kind of bureaucratic items that, make it very unappealing for someone to try to practice telemedicine here in Virginia, and also very difficult for Virginians to really find one that would work. So, so looking to expand access there, Mercatus did a health access and openness project and ranked Virginia as number 19 in regards to telemedicine. So we're basically right in the middle, but we'd like to get much better. So the places that are beating us, actually, it's kind of ironic, is, South Dakota, the more rural areas that are not around the hubs of medicine. So, but unless you're in Northern Virginia, literally right outside Washington, D.C., you're not in the hub of medicine, right? We have folks way out west that it might be better for them to go to West Virginia, or their doctor's appointment might be an hour and a half away. So better care using telemedicine technology is something that absolutely exists. It's actually, there was a survey done by a health industry that predicts the telehealth market is predicted to be $36.2 billion in 2020. So I know when we discuss this that it seems to be a little bit nuanced, but this is something that is already happening, that is already being utilized. I've used telemedicine several times and found it to be not only extremely high quality, but was more affordable and gave me quicker access to quality care. So this is something that 90% of healthcare executives say their organizations are currently implementing already. So what Virginia needs to do through this legislation is remove barriers to opening up that market for telemedicine providers to come in and serve Virginia's patients.
So, Lauren, let me ask you this, right? So you look at a bill like Senator Chafin and Delegate Kilgore. I got to get into this because I really like what you're doing. Expanding telemedicine, you're trying to get rid of the regulations, the red tape, the bureaucracy. So you go to Richmond and, it's kind of swampy there, right? And so you get all the lobbyists. And I'm very suspect of these lobbyists that run around in their $5,000 Armani suits from McGuire Woods and whatever, right? I mean, you see them every day. You know what the deal is. And so who would be opposed to giving hardworking Virginians access to telemedicine without the red tape and regulations so they can shop it where they want to get the doctor they want or the expertise they want in a way that is beneficial to average working class Virginians? Like, what lobby group is opposed to this?
Sure.
Like, who are you fighting?
Because the bill languages and what it will actually do in its entirety is not quite nailed down yet. I can tell you kind of what the trepidations are, but we haven't necessarily seen these groups are absolutely against it. These groups are absolutely on board with it just yet. It's very early in session. But the concerns are, treating telemedicine and in-person care equally is a little bit of a faux pas. And you can understand why people might say, ooh, that's a little bit different, all of these risks and things like that. There's actually a telemedicine company called Doctors on Demand. It's a giant telemedicine company. They've really taken off. They serve millions of Americans and have never had a malpractice claim, ever. So I think there's some quality control. I also think that, we are in Richmond. It is a political climate. There's a lot of incentive to kind of stick with the status quo around healthcare. I mean, around a number of things, right? But it's definitely breaking the status quo and really being transformative in the area of healthcare innovation. So I promise to keep you up to date on who our targets will be on this stuff for sure. But again, really broad-based coalition on this. Nitty-gritty details we're still working out on what everything will be included, but like I said, the basic things that we'll want to go over is allowing any properly licensed doctor to practice telemedicine in Virginia. So that means if they're licensed in New York City, they can administer telemedicine to Virginians. Like, that would be absolutely fabulous, right? I don't mind if I am seeing a doctor in New York City or a doctor in Richmond or whatever when I have a sinus infection and I need a Z-Pak or I need amoxicillin, right? Additionally, we want to treat telemedicine and in-person care equally in the terms of reimbursements and costs, right? So in doing that, we'll actually make both less. So it's essentially remote healthcare, and digital communication and technology really paves the way for that to not only exist, but to be really, really high quality. So doctors are on board with this. Like I said, it's really just knocking against the status quo, and that's what we're working against now. It's like herding cats here, John.
It is like herding cats, but I love what you're doing with that to give people better choice and better access. And look, you're always battling the status quo. I mean, Richmond's a town that doesn't like a lot of change, right? So there's always the moneyed interest that you're fighting. But I appreciate, Lauren Toomey, the work that you're doing on that. We're with Lauren Toomey. She is the Deputy Director of the State Virginia chapter of Americans for Prosperity, the largest nonpartisan political action organization, grassroots organization in Virginia by far. Lauren, let's get to one of the other topics you mentioned. You talked about COPN, which is going to come up again. Allay my concerns here. My concerns with COPN is that private profit-making companies that offer certain high-margin services will come in to an area, if you get rid of COPN, which is the Certificate of Public Need for Hospital Care, and they'll come into certain areas and offer only the most highest margin profitable services just right by a hospital. And in rural areas, hospitals are making the only profit center they have is off these certain services. Like when you take a CAT scan and things of that nature, they're highly profitable. So another company comes in, that's all they offer. They don't offer all the other things that hospitals have to do, like free emergency room care and all that. That's all they offer. And so they lower the price for that. So they skim that from the hospital. That takes the revenue away from the hospital, but then the hospital is still regulated. They still have to do everything else. And so we've seen this happen in Georgia where rural hospitals have actually shut down because of weakening the COPN laws. They've shut down, and there's nowhere for people to go. They have to go hours away, especially if they have a trauma. People can die from this or have permanent injury. That's been my logical concern with weakening COPN laws.
Sure. So I wouldn't necessarily say weaken. I would say reform. Definitely say reform. So you're right. I mean, this is a big access to quality care issue just in the matter of brick and mortar hospitals, right? And I really like that you brought up the rural folks. What happens with COPN hospitals is they tend to limit who can give specialty services, right? So only a hospital, for instance, who has COPN can administer things that go wrong in a more like complicated, say, delivery for a baby, right? If you're a young mom or you're a young woman who's pregnant and you see that only these 3 hospitals within a 2-hour radius of where you live offer those contingencies for a complicated birth, you're obviously going to say, that's where I want to deliver my child, right? Well, you and any other person is accessible to. So what happens? You end up on a wait list. You're only pregnant for 9 months. So if your turn comes up on the wait list at 10 months, thanks, see you later. So there was actually a case of a woman who was on a wait list at a hospital who had a COPN that was licensed by COPN and was able to offer these higher risk delivery contingencies and services right in the hospital. It was suspected that she was going to have potentially a little bit more of a complicated delivery, but they weren't sure. Needless to say, the baby came after 9 months. She was on the waiting list at the other hospital that did offer these services. She had to give birth at her local hospital. So sure enough, she had a very complicated delivery. What ended up having to happen was as soon as the baby came into this world, they're usually put right on their mother's chest, right? That's a very kind of formative moment, and it's the first real flesh feeling that the baby has. It's a big mommy-baby connection moment and also other human connection moments. So instead of that happening, it was very serious, and the baby was taken away from the mother and life-flighted to this nearby hospital. Everything turned out okay, but that helicopter ride, the insurance bill on that was astronomical, and it was very, very dire as whether or not that baby was going to be able to make the 25-minute helicopter ride to the nearby hospital. So by removing the certification and the permission slip from the government to allow other hospitals to be able to administer these services that they are completely capable of doing would have eliminated that problem, right? And it would also expand access. For people in rural Virginia, say you have a specialty issue and you need a specialty service, well, you have to go to the nearest COPN hospital, which is usually an hour to 2 hours away. Reforming COPN makes more hospitals able to offer the services they're more than capable of being able to offer. They're just waiting on that government checklist, right? Now, as far as costs, when we talk about MRIs, CAT scans, things like that are extremely expensive, having more competition would absolutely drive the cost down for those services. You're 100% right. That would not break hospitals' profit margins. It would just be more of a free market competition within the health market, which is great. That's great for the doctors. That's great for the patients. Everyone's getting more transparency in that regard. So I know that was a little bit of a rant, but we're very passionate about that. We've been working on that for a very long time. Opponents do, hospital associations do say it would break our profit margin, and not if it's reformed in the proper way, So that's where we're at with COPN.
Okay, Lauren Toomey, that's a very passionate analysis of that. I'm still not convinced, but I've got an open mind. That was good. You're very knowledgeable. That's why I love having you on. Hey, final question I got to take off. Gaming and casinos. Does AFP in Virginia have any position on it one way or the other?
We do not have a position on it this session. We're really diving deep into breaking barriers for Virginians, but I know that fight is heating up and definitely getting interesting.
You might find this to be a shocker, Lauren, but I'm 100% in favor of it. And have been for 10 years.
I just fell over.
I want my casino. I want to open my racetrack. I want to be able to bet sports. I don't want to have to go to MGM. I don't want to go to Dover Downs, Harrington, Charlestown, or all the other places I bump into by accident. Lauren, thank you. AFP should be for gaming. Fun. You guys are for choice. Hey, if you don't want to gamble, don't do it. Hey, by the way, try going to a 7-Eleven today and just see the number of people buying tickets and scratch-offs and tell me there's no gambling in Virginia. It's like so ridiculous.
Oh,